Good evening. My name is Jody. I'm a community education coordinator for Boulder Community Health. I'd like to welcome you to tonight's lecture on the Mediterranean diet. Before we begin, I need to make a few announcements. Please take a moment at this time to silence your cell phones to avoid interruption to our lecture. Thank you. We would also very much appreciate it if you remember to fill out the evaluation forms we gave you in your packet of handouts. We look at these closely when planning for future lectures. Also, I would like you to know that BCH has moved to a new electronic health record system called EPIC. EPIC provides quicker access to patient information, which means BCH doctors and nurses can coordinate your care better. One of the big benefits of EPIC is a great online portal that's really popular with patients. The portal lets you do things like view test results, message your care team, and much more. We call the portal My BCH. You can access it from your computer or get an app for your phone. You can sign up the next time you are at BCH for a patient care service, or you can register today using the My BCH website or smartphone apps listed on the flyer you received during registration. Finally, I'd like to go over the format for the lecture. The lecture portion will last about 45 minutes. Afterwards, we'll take about 15 minutes to answer general questions. Please limit your questions to general ones that the whole group can benefit from hearing. On behalf of Boulder Community Health, it's my pleasure to introduce our speaker for the evening, Dr. Elizabeth Cruse. Dr. Cruse is a board-certified internist who focuses on the treatment and prevention of adult illnesses and injuries. Dr. Cruse received her medical degree from Baylor College and completed her residency at the University of Rochester in New York. Her undergraduate degree is from Brown University. A member of the American College of Physicians, Dr. Cruse also served as an assistant professor for the University of Texas Health Science Center, where she was honored with the Dean's Award for teaching. Dr. Cruse is with the Internal Medicine Associates at Buffalo Ridge in Erie and serves as Boulder Community Health's Medical Director of Quality Improvement and Population Health. Please, let's welcome Dr. Cruse.
Thank you, Jody, for that nice introduction, and thank you all for being here. It's so nice to see so many people coming out for this, so hopefully we'll learn a little bit here tonight. As you know, I'm here tonight to talk about the Mediterranean style of eating. This is something near and dear to my heart because I love food, and I also actually like to cook. So hopefully by the end of this lecture, you'll have some tips and things that you can use too in your life. First, a little bit of a disclaimer. I'm a primary care physician. I'm not a dietitian. I'm not a nutrition expert, but this is something that I've come to learn myself over the last few years. Like many of you, I'm a full-time working parent with a full-time working spouse. I have 3 children, and we struggled over the years to try to figure out how to get healthy meals on the table, how to organize our lives, and so hopefully I came up with a few tips and also some tips from some experts that hopefully will help you as well. And also as a primary care physician, I am very interested in using food as medicine. Not instead of medicine, but as medicine, because a lot of our chronic diseases, as you guys know, that we see are really lifestyle related. So, to move on. So we are constantly bombarded with diet information, especially this time of year. Paleo, keto, Weight Watchers, Atkins, blood type diet. And then I had to stick a picture of Oprah after her MediFast weight loss, and I think we all know how that went. The list goes on and on and on, and it can be very confusing for patients as well as physicians. Oh, staying close to the podium, okay, sorry. it's confusing really for all of us. And you may not know, but we as physicians don't get much in the way of nutrition information and education, or education on nutrition counseling in medical school. Even cardiologists, there's no requirement on their board certification that they have a lot of nutrition education. So it does, though, often fall to us as physicians to do the dietary counseling, because for a lot of insurance coverage, a lot of insurers don't cover seeing a dietitian for most diagnoses. So how do you know what diet to pick? What is important is to know what your goal is first, and we'll talk a little bit about that. And you have to really pick what's right for you. You're not going to stick with something or a way of eating that you're not enjoying or that you don't like. It's just not going to happen. It has to really be a lifestyle change, kind of like we were just alluding to with the issue with Oprah's Medifast diet. It can't be something temporary, because you'll lose the weight, and then if you go back to the way you were eating before, you'll just gain it all back, and most of us gain back more. And most of us don't actually end up sticking with any diets. Most research would show that after about 7 days, only 20% of us are still on the diet that we started. So just like this guy, we can end up being so confused that we just don't know what to eat. Everyone knows food is bad for you, so I don't know what else to eat, this guy says. So for the next few minutes, I'm going to present information on a pattern of eating that has great evidence for health benefits, is really pretty easy, is very flexible, and can taste very good. Because it really doesn't have to be complicated. Like I tell my patients, eat real food, mostly plants, and not too much. And this is actually a quote I stole from Michael Pollan, who's a writer. And if you don't remember anything after we finish talking here tonight, this is what I want you to remember. This is it. This is all you have to remember. So unlike many fad diets, the Mediterranean diet has been studied for decades, and the evidence for benefits is pretty consistent. So it has been shown to reduce the risk of developing type 2 diabetes. It improves blood sugar control in people who already have a diagnosis of diabetes. It prevents cardiovascular disease and death from cardiovascular disease. It may reduce age-related cognitive decline or loss of memory as we get older, and reduce your risk of cancer. And because of all those things, it improves longevity. So recently also there's been a renewed interest in the Mediterranean style of eating, as in nutrition science in general, there's sort of a return to looking at diet holistically. So looking at everything you're eating as a whole, as opposed to trying to find some micronutrient that'll solve everybody's problems. So as we will discuss, the Mediterranean diet has similarities and some differences with other well-studied diets. So like the dietary approaches to stop hypertension, or the DASH diet some of you may have heard of, and the 2015 to 2020 dietary guidelines for Americans, which also has a offshoot called the healthy vegetarian diet. So there's some similarities here. So all of these diets emphasize the intake of vegetables, fruits, whole grains, lean proteins, and healthy fats. So you can see where they kind of, if this works, sort of works. It kind of overlaps in the middle there. All of them emphasize whole grains, unsaturated fats, low-fat dairy. What's different about the Mediterranean diet is it's actually not a low-fat diet. It's actually there's more of a percentage of calories from fat in the Mediterranean diet. There, again, emphasis on whole grains, extra virgin olive oil for cooking and for dressing food. And there's a greater emphasis in the Mediterranean diet on the intake of oily fish and healthy omega-3 or omega fatty acids. Also, what's slightly different about the Mediterranean diet is they do mention moderate alcohol intake as being healthy, and we're going to come back and talk a little bit about that. In the Mediterranean diet, there's no emphasis on sodium reduction, so if that's important if you have a chronic health issue that sodium reduction is important for, that's a separate issue. But otherwise, there's a lot of similarities here. So likely because of its inclusivity and flexibility and evidence for benefits, It was rated again one of the top diets this year in 2020 by U.S. News and World Report, and that was as ranked by a panel of experts. They did mention some shortcomings. One was that it's not a specific diet for weight loss, and we're going to talk about that in a minute. Also that it might be a little bit pricey, and that there is a lot of preparation work required, but we're going to talk about how you might get around some of those things. So when I started to prepare for this talk, I learned a lot about the history of this diet, and actually I was really surprised to learn that the health benefits of the Mediterranean diet have been known since the 1950s. There was this guy, Ansel Keys, this is his picture on Time magazine. He was an epidemiologist in Minnesota, and he noticed that men in Minnesota in the 1950s were dropping dead of heart attacks. And when he was talking to his friends or his colleagues in Italy, they were not noticing the same thing. And this is despite the fact that these men in Minnesota were men of Italian descent and were living in a more affluent country. They were dying sooner. And when they looked at the diets of these two groups, the colleagues in Italy said, well, you know, this is post-World War II. They didn't have access to red meat. They were poor. So mostly what they ate, what was local. They ate, you know, whole grains, vegetables, fruits, olives, olive oil, and they drank wine in moderation, and they also were moderately physically active every day. So noticing these things, he got a group of his colleagues together, and they started what is still going on today. It's called the 7 Countries Study. So he had colleagues in all of these different countries, and they just started collecting data about diet and health. And on the next slide, you can see some of their results. So this slide compares 25-year coronary heart disease, that's what the CHD stands for, mortality rate, graphed against a food factor score, and a negative food factor score is better, or means that there's more adherence to the 18 healthy foods that they were tracking. And so up in the upper left-hand corner, I don't know if I can get my pointer to work, but you see the E, oh, there it goes. I can't see it, but y'all can see. So the E up there is Eastern Finland. This is Western Finland and the Netherlands on top of each other, and the A is the United States. And then down on the lower right-hand side, the U and the T are 2 villages in Japan. And then this is Italy, M, Greece, and Crete. So you can see that the countries where there was more adherence to the Mediterranean style of eating had much lower coronary heart disease rates than our typical diet, the Western diet. I know, don't turn my head.
No. You're doing great. Just stay there. Sorry to interrupt, but we've just noticed that someone has left their lights on in the parking lot. So to quickly interrupt, the license plate is BFD I58, and it's an SUV. So if that belongs to anybody, you want to go out and check your lights. Alrighty? That's BFD 158. Thanks.
Thank you. Good. So some interesting data there. So I was also very interested to learn that the first low-fat, low-cholesterol cookbook came out in 1951. I couldn't find a picture of it online, though, so just found some pictures of some old cookbooks, and that the American Heart Association came out with its first dietary guidelines regarding fat and cholesterol in 1957. This is quite a long, it's a while ago. The United States started doing health food guidelines in 1980. And since then, those have been revised about every 5 years, and maybe partly why we all are a little bit confused, because the American food guidelines really represent this dance between evidence-based medicine and the food lobby or politics. So that's why if you feel a little bit confused about the recommendations sometimes, that's partly why. So we know that the Mediterranean pattern of eating or Mediterranean diet has always been in the background, and it's just been overwhelmed at times by other fad diets that have come out. And what it's really important to know, it's a pattern of eating, and it's really about a total lifestyle. It's an inclusive dietary pattern, and it's really defined more by what you can eat rather than what you can't eat. There is no such thing as bad food in the Mediterranean style of eating. Variety is really the key, But it's also important to remember to get the majority of your calories from the vegetables, fruits, healthy fats, and lean proteins. And then the other thing I want you to remember is that very bottom, the foundation of the pyramid, which is also very important. So the plate is another way to look at how to divide up the calorie intake or the different kinds of foods that you're going to eat. This is from the Veterans Administration. So it just divides up the plate. Half of it is vegetables, a quarter of it is whole grains, beans, legumes, another quarter is your lean protein. And to remember to drink mostly water and that to use fruits as your dessert. So what has made this diet even more popular more recently is the mounting scientific evidence about the multiple health benefits, which we'll now review. So first we're going to talk about the evidence for the Mediterranean diet and weight loss. And as we talked about earlier, like this woman, most of us end up gaining weight when we try to change our diet. So again, we are constantly bombarded with information about how to lose weight and constantly looking for some magic trick or combination of nutrients or supplements that'll just melt the pounds away without us really having to do anything. We all know that's really not true. Multiple studies have shown that when your goal is weight loss, it is really about calories in and calories out. It's boring, but that's really what it's about. But the quality of the food that you're eating and the content can be really more important for are you going to stick with this diet. Again, back to that, if you're eating things that you really don't like, you're not going to stick with this change. So they have done lots of studies looking at comparing the Mediterranean style of eating to other diets. And there was, what I've reviewed here is there was a systematic review. So they pulled a lot of different studies from the literature. And they pooled all these studies and they had about 1,000 overweight and obese people in this pooled study, the systematic review. And all of these studies compared the Mediterranean diet to any other diet. And they had to have followed the people on the diets for at least a year. In all of the studies, the patients received counseling about nutrition, and in about 2/3 of the studies, they also got a prescription about exercise. And what they found is kind of what we've alluded to, is that there was really similar weight loss in all of the groups. The Mediterranean diet wasn't specifically better for weight loss than any other diet. However, they did see in the majority of the studies that there was greater improvement in blood sugar control in patients with diabetes on the Mediterranean diet as opposed to some of the other diets. So just something a little interesting. So it may not be, if weight loss is your goal, it's really about calories in, calories out. Oh, and I forgot to mention, there was another this is my favorite thing I like to tell patients about, it doesn't matter, it's calories in, calories out. A dietitian did a really cool study where he ate Twinkies all day and proved that he could lose weight. He felt terrible, but he lost weight. So a lot of thought about the anti-inflammatory properties of this diet. A lot of people have thought about this and thought if you're eating this way, perhaps we will see a reduction in the risk of cancer in patients who follow a Mediterranean style of eating. Now you can imagine when you're looking at this kind of outcome as far as cancer, developing cancer, randomized head-to-head studies where you start with a group of people, put one on a diet, one on a different diet, and then follow them over a period of time is really difficult to do. It's very expensive, so it hasn't been done. So what we really have are mostly observational studies. So, for example, researchers performed a search of the literature and they again pulled together many different trials looking at the Mediterranean diet and the incidence of cancer. So again, the systematic review, they went through over 500 trials and they found 28 of which they thought were well-performed trials, and these 28 trials included over 500,000 participants. Only 4 of those trials failed to show a benefit of a Mediterranean style of eating and a reduction in cancer, so pretty good. And consistently, most of the trials noted that what was most notable was a reduction in the risk of digestive tract cancers, so that's something beneficial. Now, to sort of support this observational evidence, there was a more recent, actually was a randomized trial called the PREDIMED trial, which we're going to talk more about in a few minutes. And they took a subgroup of this randomized trial and followed them looking for breast cancer outcomes over the almost 5-year period of the trial. And they did see a reduction in breast cancer in that subgroup. So it's some randomized evidence that sort of supports the observational things that have been noted. So along the same lines, there's been really interest in the role of diet and the risk of developing memory loss as we get older. So further research is still needed, and it's the same issue that we have with looking at cancer outcomes, because you just have to follow people for so long. There's not really any head-to-head comparisons of the Mediterranean diet and other diets when you're looking at memory loss as an outcome. But many studies suggest that a healthy diet may reduce the risk of developing dementia and other forms of memory loss. Most of the studies did measure diet adherence. They looked at, made sure people stuck with the same diet over time, and better adherence to the diet was related to better outcomes. So again, systematic review comparing adherence to the Mediterranean diet and cognitive outcomes. They found 12 studies. 6 of the 12 studies with pretty good follow-up, 3 to 7 years, did show benefit. The other 6 showed benefit too, but it wasn't statistically significant. And the authors of this systematic review noted that, all these trials are really very different from each other, so it was difficult to kind of pull them all together and make a conclusion. Again, that same trial, the PrediMed trial, they had another subgroup that over the 5 years of follow-up, they were doing a battery of cognitive tests with this group, and the group that was on the Mediterranean diet actually improved over time on all the cognitive tests. So again, some research that might support the observational studies. So unlike this guy, I hope you guys see your primary care physician as someone who wants to keep you healthy. You don't have to have a disease or a problem to come see us. We want to prevent things, so just come by. That was just my little interlude commercial, okay? So what about the Mediterranean diet and longevity? So there have been a large observational epidemiologic studies and 2 large randomized trials that have shown increased life expectancy in people who follow a Mediterranean style of eating. They think it's probably because most of the people who eat this way have there's less burden of chronic disease in these groups. There was also a trial called the multi-ethnic cohort study, which followed over 200,000 people for 13 to 18 years. And they did one baseline food questionnaire. So they just did the food questionnaire and then they followed these people over time. They never asked them again what they ate. But they did find that the people that endorsed a more Mediterranean style of eating at the beginning of the trial had lower rates of death, cancer, and cardiovascular disease. The other interesting thing that some researchers have noted is that people who eat a Mediterranean diet have what are called longer telomeres. Has anybody heard what a telomere is? So we all have them. They're little caps on the ends of our chromosomes. And what they do basically is they prevent the chromosomes from sticking together. And chromosomes contain all of our DNA and all of our cells. So they prevent the chromosomes from sticking together, and they also prevent them from getting old. So the shorter your telomeres, the older your cell is, and the more risk there is for something bad to happen, like developing cancer. So people who follow a Mediterranean diet have been found to have longer telomeres, therefore younger cells, therefore less risk of cancer, et cetera. So it's kind of interesting, I thought. So now we're getting down to the meat of the evidence. So what about the Mediterranean diet and diabetes? Multiple studies have examined the effect of the Mediterranean diet on either the prevention or treatment of type 2 diabetes. And we're talking about adult onset diabetes specifically. So you know that diabetes is a global epidemic. It's associated with our global epidemic in obesity. It's estimated that diabetes is going to cost us over $590 billion worldwide by 2035. Right now in the United States, it already costs us about $140 billion a year. Nutrition therapy is the foundation. It's integral to treating diabetes. And the Mediterranean diet is now actually recommended by the American Diabetes Association for all of these reasons. It's been found to lower your body mass index and decrease your waist circumference, because abdominal fat is associated with developing diabetes, hypertension, etc. In people with type 2 diabetes, they see an improved hemoglobin A1C, which is a marker of your blood sugar over time. It's just as good as adding a medication, and I can say it probably tastes a lot better. It increases the risk of the chance that somebody who's on their way to develop diabetes, hypertension, that's what the metabolic syndrome is. It's a syndrome of abdominal obesity, hypertension, prediabetes. So people who follow a Mediterranean diet can go into remission and lose all of those problems. There's other very beneficial, this is where I messed up this slide, beneficial cardiovascular benefits. That doesn't sound right, but you know what I mean. And we're going to talk about those in a few minutes. And as we said, it's recommended by the American Diabetes Association. So this guy says, my bones are getting softer, but my arteries are getting harder, so it's just balancing out. So we know that that's not true, and this is really just to help me remember that we're going to talk about heart disease next. So all of you guys you probably know that cholesterol is key in developing plaques in our arteries. So these are just pictures of arteries with plaque buildup. This, again, like we talked about earlier, has been known for years. Bad cholesterol can build up and cause plaques in your arteries, which over time reduce the blood flow to some major organs. And that's what causes strokes, heart attacks, peripheral artery disease, which causes pain, can cause pain in the legs because they're just not getting enough blood flow. Poor lifestyle choices may account for about 40% of premature cardiovascular disease. And we know that weight loss and a low-salt diet leads to decreased arterial stiffness. It makes your arteries be more flexible so that every time your heart beats, they can kind of expand and your blood pressure stays low. Diets high in fruits and vegetables reduce the risk of developing high blood pressure, strokes, and heart disease. And so if you can imagine if we'd all eat a little bit better, we could really reduce that amount of money we're spending every year on chronic disease if we could reduce it by 40%. That's pretty significant. So there were a couple of landmark studies on the Mediterranean diet and cardiovascular disease, and the first one I'm going to talk about was the Lion Heart Study, and it was published in 2001. So this was a study of secondary prevention. They enrolled people who had already had heart attacks, and they were hoping to prevent future heart attacks because those people are at the highest risk. They randomized them to either getting a Mediterranean diet supplemented with a special margarine that was a substitute for butter and cream versus another group, the control group, that got no specific dietary recommendations. And at a little more than 2 years of follow-up, they saw a 73% reduction in recurrent heart attacks in the Mediterranean diet group. So pretty significant. Now what's interesting, though, I thought was interesting, was there was only a 4% difference in the amount of total fat consumed between these two groups, and a 4% difference in the amount of saturated fat, which is animal fat, consumed between these two groups. So that doesn't sound like a whole lot. But it is actually, so if you think about it, it's more consistent with this theory that it's really the whole diet. It's not the components, it's the whole thing together that is beneficial. So the more recent trial that we've alluded to, or I've alluded to a couple of times, was the Predimed trial. This was a multi-center randomized trial conducted in Spain. They enrolled 7,447 people aged 55 to 80 years who had no history of cardiovascular disease, so it was a primary prevention trial. But all of the people in the study were at high risk. They had risk factors for having heart attacks and strokes. They randomized these people to either a Mediterranean diet supplemented with 50 cc's of olive oil a day, which is about 1/5 of a cup, or the Mediterranean diet and 30 grams of nuts a day, and 30 grams is about 1 ounce, versus the control group, which they got nutrition counseling on a low-fat diet. Now their primary endpoint, that what they were looking to do was to reduce the major cardiovascular events, which includes myocardial infarction, which is MI, or a heart attack, stroke, or death from any cardiovascular disease. And they were hoping to reduce that by 20%. But the trial was stopped early at 4.8 years because they saw such a dramatic difference. They saw even a greater difference. And on the next slide, I just included a graph that shows that. It's not really important to know exactly what this graph says, but know that the red line or the top line were people who had less adherence to the Mediterranean diet, and the black and the green are people who adhered more to the Mediterranean diet. And what they saw was a 30% reduction in heart attacks, strokes, and cardiovascular death. And they thought it was unethical to continue the trial beyond 4.8 years. They stopped it. So again, it was a great trial, that it was randomized, all those things that scientists like, that proved what we had seen in observational studies for years. One thing I forgot to mention is that they also saw a decrease in the incidence of type 2 diabetes, peripheral artery disease, atrial fibrillation, metabolic syndrome, and hypertension in the group on the Mediterranean diet. So this is just another way to look at data. Relative risk reductions can be a little bit deceiving because, if you go from 2 to 1, that's a 50% risk reduction, right? But that doesn't mean anything. So another way to look at data is to look at the number needed to treat. How many people do you need to give this treatment to prevent one of whatever you're trying to prevent or treat? And so here the authors of the trial gave us those numbers, and you can see you only need to treat one person with a Mediterranean diet for 4.8 years to prevent one of the cardiovascular outcomes. And that compares very favorably with any medicine or other prescription that I could give you. And it tastes better. So what does this all mean for us in our day-to-day lives? Hopefully, after hearing all this information, you think, hey, this sounds like a good idea. But how do I do it? What does an increased vegetable and fruit intake look like? And what if I don't like fish and I'm not going to eat it? Does Mediterranean diet mean that I just eat Italian food? No, it doesn't mean that at all. So remember that the Mediterranean area encompasses 15 different countries at least in that area. So it's countries with Italian culture, French culture, Arab culture, African, Greek. There is no pure Mediterranean diet. As I like to tell my patients, you can even eat Mediterranean Mexican food. It's possible. And to sort of support that, there was another study that looked at applying the concepts of the Mediterranean diet to an Indian Asian culture. And they saw a 50% reduction in non-fatal heart attacks and 60% reduction in sudden cardiac death in their group. So, and also remember Japan from the earlier slide. Japan is nowhere near the Mediterranean, but those people also had a very low risk of cardiovascular disease. So remember, really, it's an eating pattern. It's not a diet per se. Again, like we talked about earlier, you have to look at calories to lose weight, but this way of eating may end up being more filling and satisfying because we eat with our eyes and our nose as well as with our mouth. So remember that the base is vegetables, fruits, and grains. And one way this diet could potentially help you lose weight if that's your goal is because doing that will increase the amount of fiber in your diet. The recommended amount of fiber is about 25 to 30 grams per day. Most of us don't even get close to that. But if you do, it will improve your digestion, but fiber also decreases the bad cholesterol and really helps you feel fuller. So if you're trying to lose weight, you might feel fuller and be able to lose weight better. And so I'm going to spend a little bit of time talking about the other components of the diet now. And a big one is fat. Like we talked about, the Mediterranean diet is not a low-fat diet. It's a low saturated fat diet. And the difference is most polyunsaturated and monounsaturated fats, which can have some benefits to lower bad cholesterol and raise good cholesterol, are liquid at room temperature. The easiest way to remember it is usually liquid fats are healthier than solid fats. That's usual. Now, it doesn't mean you can never use butter when you cook. So what the American Heart Association recommends is that we get less than 10% of our calories from saturated fat daily, which comes down to about, if you use a tablespoon of butter a day, that's probably fine. So if you have a recipe that calls for a little butter to give it a little flavor, that's fine, use that. But it's just really focusing more on these plant fats. Now, of course, the Mediterranean diet traditionally focuses more on olive oil, and certainly olive oil is great, but it's not the only one, and some people don't like it. And really, and all of the different liquid oils have, different amounts of poly and mono and polyunsaturated fats. It's really choose the one that's useful for you and depends on what you're doing. So Olive oil certainly, especially extra virgin olive oil, is really good by itself on bread. You can use it as a dressing for food or salads. You might want to choose grapeseed oil if you're looking for something really light for a salad dressing, for example. Avocado oil actually is really great at high temperatures, so if you're cooking food at high temperatures, you might want to choose olive oil as opposed to, you certainly wouldn't want to use walnut oil for that, it'll fall apart. So that's really the difference, it depends on what you're trying to do. And again, fats are good because they do help us feel full, they help us feel more satisfied, food tastes better. But again, if your goal is weight loss, fats have more calories per serving than any other kind of food, so you do have to watch that. Oh, and I forgot to mention, fats also come from other food sources, of course, like nuts and fish and low-fat dairy, which we're going to talk about in a minute. So proteins. Proteins, beans, legumes, fish, white meat, which can include some cuts of pork, nuts, and then low-fat dairy. And why do I say low-fat dairy? It's because most food experts are really saying, you know, if you're going to eat dairy, eat low-fat dairy, and the reason is because the jury's kind of still out about the saturated fats and the whole-fat dairy. So that's why I say that. There have also been concerns about mercury levels in some deep water fish, like shark and mackerel. So that's led to some recommendations about people eating more salmon, tuna, pollock, and catfish. But most of those mercury concerns are more for women of childbearing age or who are pregnant. Most of us middle-aged types, that's not really something we need to worry about, and the benefits of eating any kind of fish far outweigh the harms. And then other thing to remember, if you remember the top of the pyramid, and remember we said there's no bad food. And really what you have is special occasion foods, as my dietitian colleagues like to say. So most of us may not think of fruit as dessert, but if you can choose to eat fruit as dessert as opposed to cakes, cookies, pies, that kind of stuff, ice cream, that would be a big step. But people always ask me about this, what about chocolate? So chocolate is made of cocoa butter, as you know, which is high in saturated fat. But it also has a beneficial omega-9 fatty acid, which may reduce your risk of heart disease. So experts say moderate consumption of chocolate is just fine. What is moderate consumption? About 3 to 4 ounces a week. And if you remember, an ounce is about a square of the chocolate bar, right? Not the whole chocolate bar. So also the other thing that a lot of experts say is that if we could give up sugar-sweetened beverages, many, many chronic diseases would just go away if we just did that. If you could focus on drinking water, you know, nowadays we have lots of choices with the flavored waters that have come out, unsweetened tea, that just takes a lot of calories out of your diet. Even diet soda may not be so healthy. You may have heard that the artificial sweeteners and even some of the natural sweeteners with no calories, they make your sweet taste set point kind of high. So it takes more sweet to satisfy you than if you were not drinking those diet sodas. You'd be satisfied with less and therefore probably eat fewer calories. And then last but not least, I want to mention alcohol. So as we talked about, the Mediterranean diet does include moderate consumption of alcohol and it can be healthy. But as we all know, alcohol is a slippery slope. Now, experts would say if you don't drink, do not take up drinking thinking it's going to be healthy. But if you do enjoy a glass of wine or something once in a while, just remember that moderate alcohol intake is defined as an average of 1 drink a day for women and no more than 3 at a time. Sorry, ladies. And for men, no more than 2 drinks on average per day and no more than 4 at a time. And what's a drink? So I ask my patients, they say they have 5 drinks a week, and I go, do you have a drink or do you have a drink? So a drink is 5 ounces of wine, 12 ounces of beer, or 1 ounce of spirits. So that's what the definition is. And it's just a narrow therapeutic window, so you just got to be careful. And then you always want to discuss with your doctor if alcohol is safe for you, given your medical problems and medications that you take. And the other thing I squeezed in on this slide, which is probably too much, is remember the 80-20 rule. So remember the quote from Michael Pollan and remember the 80-20 rule. If you eat well 80% of the time, you're doing great. That means that 20% of the time you're having a bad day, things just fell apart, your plan fell apart, you didn't get home in time to cook, you just want to go out, that's fine. Give yourself credit for that 80% of the time you're eating really well. And then, like I mentioned, don't forget that base of the pyramid. Move a little bit every day. Get at least 30 minutes of some kind of exercise, which walking is the easiest and best exercise. And then eating together, eating socially. Even if we don't like people, we're social animals. We do better in groups, so eat with your family. So what about some tips about how you can incorporate this into your life? I think what's worked best for my husband and I, like I mentioned, we have 3 kids. We both have always worked full time. And a lot of other experts recommend this as well, is sitting down once a week to plan out your meals. If you don't come home hungry and if you come home hungry and you don't have a plan, you are much more likely to reach for or eat something that you wouldn't have done otherwise. So we have made a menu for the week. We make a shopping list, and we go shopping once a week. And then on the weekends, if we have time, we'll meal prep. So that's another thing you can do. You can chop up things, have them ready to go, make things ahead, put them in the freezer, make a big batch, put them in the freezer for later. And if you guys have kids, if you can engage your family in cooking, I have not been very successful in this, but I know other people who have. Getting your family to help, but I certainly have a great husband who also helps me out. The other thing is I put this acronym here, KISS, or Keep It Simple Stupid. We rotate through a few different recipes every week, so it doesn't have to be fancy or complicated. We have a taco night, we have a pasta night, we have something grilled, we have a stir-fry night, and we rotate pretty much through that during the week. And on the weekends, if we have time and we want to cook something more complicated, that's when we do our experimental work. The other thing that I really like is eggs for dinner. Eggs are a great food. They're inexpensive. Great way, you could just make a frittata with your leftover veggies. It's really quick and something to do if, otherwise things fall apart. And the other thing we talked about earlier is this diet really doesn't have to be expensive. I'm going to give you some resources on the next slide. Frozen vegetables have just as much nutritional value as fresh, so certainly much easier and cheaper for some people. So some of the websites that I and my colleagues and my dietitian colleagues like to recommend, the first one is this Old Ways website. It has a lot of information just about the Mediterranean diet in general, but it also has a ton of free recipes from all over the world. They have a set of recipes that cost less than $2 a person to prepare. I also like the Nutrition Source, which is from the Harvard School of Public Health. They've done a lot of the basic research looking at heart disease and diet. They've teamed up with the Culinary Institute of America, and they've created recipes that are available for free online. And also I put Cooking Light on there. It unfortunately doesn't exist as a magazine anymore. It got bought out last year. Oh, yay! Okay, good. Because that was what I used, before the internet was so big. I had my subscription to Cooking Light, and they have a lot of recipes that are also inexpensive. I like it because they do makeovers of meals that you like beef stroganoff. They made it over and make it healthy. So just to show you that you can eat what you like, but it can be healthy. And so here's some beautiful photography pictures of food from the internet, but just some examples I like avocado toast for breakfast in the morning. Avocado is a great spread substitute for butter. Also nut butters if you like those with a little fruit. Great breakfast in the morning. My other favorite is in the middle, the overnight oats. Those are really easy to make the night before and just pick up, grab and go. And I was kind of joking, if someone would make me this salad every day, I would eat a salad every day. It's beautiful. But you can prep your ingredients and kind of throw them together as you're walking out the door. So just spend a little bit of time cutting things up, and then you can just throw it together. And then, of course, soups are always really easy to cook and freeze in advance. And then over here is, this is actually not a picture of what I made, but this is one of our favorite weekly meals. It's a whole grain pasta with spinach and prosciutto and olive oil. It's really tasty. And then, of course, I had to throw in the eggs for dinner. This is a picture of a meal called shatsuka, and I'm not even sure I say that right, but it's from Israel. And it's basically just vegetables and eggs. That's basically what it is. Now, here are the non-beautiful pictures of the food that I make at home. But so these are just some examples from our last week. This is my teenage daughter's favorite meal. It's a sautéed salmon with lentils and sautéed greens. So And then I had to put a picture of the roasted Brussels sprouts. How many people in here like to roast their vegetables? Awesome, you guys already know the trick. Because I always tell people, if you don't like a vegetable, roast it, and then you will like it. It's super easy and super fast. You just cut them up, toss them in olive oil, some pepper and salt, throw them in the oven at 400 for 15 minutes, and they get all caramely, and they taste really good. So I would try that with a vegetable you say you've hated since childhood. So this is just a little shrimp risotto, shrimp and lemon risotto with those Brussels sprouts that really didn't take much time at all. And this is an example of pasta puttanesca, which is a really easy pasta sauce to throw together. It literally takes 15 minutes. It's cans, you dump and cook. And then, of course, we all have days where things don't go well. This was a day where I forgot my lunch. But I found a healthy, this is an example of Asian Mediterranean. So this is like a little grain bowl with quinoa you can't see on the bottom and lots of fresh veggies and tofu. So it is easy to find, it is possible to find takeout food that's not too expensive. I think this was less than $10 and healthy. So
Thank you,
that
Dr.
is
Cruse.
my talk, and thank you very much for your attention.
Thank you, Dr. Cruse. We are going to take questions. We ask that you utilize the microphones on each side of the room for your questions. Just get up and somebody will turn it on for you and make sure that you're able to ask them. Thank you.
I answered all your questions. That's good. I don't know who's there. Do you want to go ahead?
Sure, I love olive oil, but a cup sounds like a lot per day.
It was they had about a fifth of a cup in that trial per day.
Oh, a fifth of a cup?
Yeah, a fifth of a cup, and they gave each of those families, so it wasn't the whole family that was in the trial, but interestingly, they gave those families a liter of olive oil to use every week. So the families of the participants went through about a liter per week. So it sounds like a lot, but ways you can, if you're looking to use it sort of more as a way to see, can I feel more full? Can I lower my bad cholesterol and raise my good cholesterol? You can use, of course, salad dressing. That's easy. Use it to cook. That's what we do. But you've noticed probably in restaurants where they drizzle a little bit over the food, you use it as a flavoring. So that's where probably they get in a lot more of that volume.
So a fifth of a cup per person per week?
Per day.
Per day. Okay, thanks.
Oh, sorry. Yes, I'm
Yeah,
going
we
this.
roast Brussels sprouts a lot. How do you keep from stinking up the house?
I don't. Luckily, I live in this area where we can open the windows. I'm from Houston. We never could open the windows there, but yeah. I'm sorry, go ahead.
My question is about cheese.
Oh,
Some of us like cheese.
yes,
It was at the top of the pyramid or near the top.
yes.
And somebody we were with recently read a book called The Cheese Trap. Have you read it?
No, I haven't.
They said if I read that book, I'd never eat cheese again.
So you didn't read it?
I haven't read it yet. I probably won't. But what would you say about cheeses and particular cheeses or anything you want to let us know?
So some of the I don't know a lot about this, but I would say some of the harder cheeses like Parmesan and stuff have less oil than or less fat. But really, again, it's just back to it's the less often and maybe less of that kind of food as opposed to other kinds of food. So it doesn't mean never, it just means less. I don't think there's anybody over there. I think it's you.
Okay, two questions, rice and avocados. So, of course, I've always heard eat whole grain everything, and I've eaten whole grain rice. I just recently heard that eating whole grain rice can be a problem because it gets stored for a long time and it can become rancid, and that it's actually better to eat white rice. Do you have an opinion on that?
I haven't heard that, so I don't know anything about that. So
My
no, I
first
haven't heard
time
that
too.
at all. Yeah.
Okay, second question, avocados. So I also eat avocados every night in my salad. And I just recently found out that avocados are a histamine. Any comments about that?
You know, if they don't bother you, it's not anything to worry about. Yeah.
Okay.
Hi.
What have you heard about the nightshade vegetables?
I know I've seen that in the lay literature about that, and, really there's again, it gets back to that you're going to hear these confusing things that really may not be actually based in science. So as far as I know, again, saying as far as I know, no evidence that those are necessarily bad or shouldn't be eaten, unless you have an allergy to them or something. Okay. Yeah.
All right, we have a quick question from one of our online viewers. We are live streaming. So what kind of salmon do you prefer, and where do you get your salmon?
Oh, what kind of salmon?
Yes.
Oh, really any kind is fine, farm raised or wild caught. I think that's sort of more of a maybe political decision or something like that. I buy the farm raised salmon in the grocery store like everybody else does. So I think it's that kind of decision is more of a sort of like a more of your environmental sort of what your beliefs are. So, but they're both equally nutritious. And the frozen is just as good as the stuff you might buy fresh in the grocery store. So that's important to know too.
Hi. What do you know about coconut oil? It seems like I've seen wildly varying opinions on it.
Yeah, it was a fad for a while, and it is, again, so it's good to remember it's solid at room temperature. It is high in saturated fat. So yes, again, it's one of those things like butter you use for flavor, and you can use for, it can help in some baking and things, but again, it's something you want to use less of because it's high in saturated fat. I actually had a patient who somebody told her to start eating that, like a jar of it, and her cholesterol it was incredible. It was like up in the 400s, 500s, it was really high. So it's a saturated fat, just remember that. Put it on the outside. Yeah. You smell good.
Do we have any other questions?
Well, thank you all for your attention. I appreciate it. Oh, wait, one more question. Sorry.
One more question from the online viewers. Do you have a favorite cookbook recommendation?
Yeah, I have a closet full of cookbooks that I don't look at anymore because of the internet. So, I mean, it used to be the moosewood and all of that, but yeah, no, nowadays it's the internet is my favorite cookbook. Thank you for
Thank you all for
very
coming.
much.
Thank you, Dr. Chase.
Thank you.
Please take a moment to fill out the evaluations if you would and turn those in. We really appreciate the feedback. Thank you for coming. Have a great night.
Thank you very much.